But occasionally, while we are with them, we think sometimes some of them are putting on the show. We think they are making it up. We think they are pretending. We think they are exaggerating. We think they are ill. That when it gets to my turn, I will never do that. When I was younger and other people used to work like this, I said, why do they work in that manner? I thought they were just dramatizing that they didn't have to work in that place until lo and behold I am arriving and I found it pain to put your leg in certain areas when you are in pain you have to shift and that's the reason. So that's why we want to we've all done a bit of biology, all of us in school. So we're talking about the physiological changes of aging. First of all, we want to start and say that aging is part of its physiology. It's not an abnormality. It's not a disease. We must grow old. You either grow old or you die. One of the two. No third method. Look at these beautiful babies we have here. Were they like that on the day they were giving birth to? And they are like this very, very soon. By the grace of God, they will be like you. Whether, no matter what, let you don't feed them. So this is it. So we want to study briefly what changes in the body, that makes us grow old. Normally, all these things I'm going to tell you are normal things. No sickness, no illness. So again, I'm presenting this in non-technical language as much as possible. This fundamental process and principle of aging to help us in relating to them with the aging, because we know because they have this condition or they are this level, this is what to be expected. It is not their fault, and they cannot control it as such. So this approach, communication and other activities, what I can do, they cannot do it. What she can do, I cannot do it. So we know what they can do. Again, we say aging is a universal. It happens to everybody. Predictable process. It must come as long as you are living. It is when they say unidirectional, one way. You are growing old, you cannot grow young. You can't grow old today and grow young tomorrow. It is unidirectional, that it is irreversible. And it starts from the day you were conceived, not the day you were born. The day your father and mother's egg and this thing mix together to form the baby, that is when aging process is starting. Because a 2-month-old pregnancy is younger than a 5-month-old pregnancy, and the baby in it, and so on and so forth. So this is it. Hey, but I want you to say, okay. So we've said again that the physiology is biology and not pathology. We know what pathology means. It means disease portion. Biology is just normal, 2 cells and so on. And it happens to everybody. From experience, in those with research, they've done a lot of work. Why do we age? What is really responsible for us growing old? You understand? So they know that, like we said, okay, forget about that word sickness. That means progressive deterioration of bodily function. And as we age, bodily function starting from cells. You have the cells, the smallest thing in the body. 2 cells or so many cells come together to form a tissue. You understand? Your skin. Different tissues come together to form an organ. If you take your heart, the heart is made up of different types of tissue, and all of them eventually made up of cells. So these changes start from cells. Then you have what we call systems. That is, you say, okay, cardiovascular system is the heart, the blood vessels. You understand? Respiratory system is the lung, and some other systems like blood. So So now they say we have 2 theories. Some said there's what we call error theory. We're supposed to sit down and say, what are the type of things that can cause this thing? They call it error theory. That maybe as we are growing old, wear and tear, the way we use our body. You understand? Somebody gave an example, say, you buy a car, it is made today from the same factory, the same type of car, and you are giving one, I am giving one, and you drive your car after 1 year, maybe 10,000 kilometers, and I drive my own 400,000 kilometers. Obviously, which one will be more used? Which one is likely to grow older first? So these are the various. They don't know. They think maybe they're just postulating what we call theories. So these are it. That maybe wear and tear, the extent to which we use our body is causing it. Maybe the rate of living, we say live fast and die young. Like we talk about how rough you feel your body. Maybe there's what we call cross-linking. That is things in our body getting wrinkly. Like people developing wrinkles. I like the way my grandson congratulations. He says, "Grandmommy, you don't look like a grandmommy." I say, "Why?" He said, "Because you don't have wrinkles." Praise God. But it's not my fault. I don't even know how it comes. But somehow this is part of the aging process. And the free radicals also the same thing. That is aging. As interaction in the body takes place, sometimes you can have poisons and so on and so forth, which you call free radicals, which if not removed from the body can cause further damages, and we have things to counter the effects. Then another one is called programmed error. That is, this has been programmed. It will happen in your body. There's nothing you can do about it. That as we grow older, certain things in our body called endocrine, like certain chemicals produced by the brain, which is controlling bodily functions, that they start going down, because this is part of the aging thing. And when they start going down, I have less production of less of the endocrine. Therefore, the bodily functions that this endocrine, these chemicals control, start to slow down. So you have all the systems of the body, all these things slowing down, less of certain things are being produced, and so on and so forth. Immunological, that is, you don't have enough, not resistance to disease and so on. As a young adult, what his own body, nothing. When you were young, nothing. I could do anything, I could eat anything, I could go to anything, anywhere. But as you are growing older and older, you find that you cannot just use your body anyhow, and you don't have enough strength to bounce back when certain things happen. So all these things have been said. So I've been said again, aging is not a disease. So those poor people, it is not a disease. They are biological and not pathological. However, all these aging changes, even though they are not a disease, because you have lowering of certain things, strength, immunity, chemically in your body, you are predisposed to getting more, you are vulnerable to diseases more than when you were younger. So this is the disadvantage. Though it is not a disease, but like I said before, however, aging changes can increase vulnerability to disease. Do you understand that? So, then again, they say factors affecting aging and longevity. Okay, some people, you can see a 90-year-old somebody looking fit, whereas this 65-year-old somebody looking dejected and so on and so forth. Sometimes the chemistry of your body or your inheritance, your mother, your father are this and therefore you are that, can also cause it. And also some other lifestyle, especially, if you are smoking, you are drinking alcohol, you are using drugs, you are treating your body anyhow, your body will treat you anyhow too. Like if you take good care of your body and you are doing the correct thing as much as possible, you read the consequences of those things, and they can affect your growing old too. You understand? Then I talk about all the systems. The systems as we described them before, that is the cells becoming different systems of the body. All these things affect the various systems of the body. The cardiovascular, like the heart and blood vessel, the lungs, like our respiratory system. You can see them, they can't breathe well, they are having cough, they are having this and that. They are panting because both cardiovascular, they are breathless and so on and so forth. Brain, the brain, maybe we come a little to that. Maybe their brain is not as sharp as yours because certain things are being decreased. The transmission of electricity or something in the brain is slowing down. Therefore, sensitivity of the brain and other things that the brain control is slowing down. Then of course you have our kidneys. You know that sometimes the kidney is bad or getting weaker than before. The bladder, that's what we talk, the incontinence, all those things, controlling it, helping you to hold your urine. It's becoming like a baby. The baby is still learning, still being built up. You get to adult stage, then gradually it's going down, and to hold it is becoming very, very difficult, more and more difficult. Then sometimes they say body fat and muscle mass. Sometimes, as an old person, in some the fat diminishes, and you have more the bone problem also, and the bones. We talked about that pains in the bones not being as strong as before. People falling down, fracturing easily, more than before. You understand? Then in all their senses too. These are the changes taking place in these poor people. Your eyes becoming old, have what you call presbyopia. Your eyes cannot see as sharp as before. Therefore, those of us who have been wearing glasses since I was 10, but you have some, you start picking up glasses from 30, 40, you can't read what you used to read before because your eyes are getting dimmer and blurring. And these are the things that can be responsible for it. You understand? The lens, that is that the things that are supposed to be clear, now becoming opaque, that is you can't see through it as much as before. And the people shrink, becoming less flexible. That is why sometimes you can't see at night, or light in your body, glaring in your eyes. Sometimes I don't drive at night because it's very difficult for me to focus. In the afternoon, fine, but at night with the lights on, I avoid driving. It's very difficult for me to focus unlike before. You understand? And there are other things like cataract or glaucoma. These are all these. Not always. Some younger people have cataract. Some younger people have glaucoma. But it is commoner in the older ones. Not everybody. Then also what we call degeneration of the macula. That is the macula at the back of the eyeball. Degeneration. All of this leading to you're not being able to see well as much as possible. So what are the things you can do when you are looking after these people? You say, Mama, can't you see? Papa, can't you read it? They can't. It's having difficulty, and some of them may withdraw and get annoyed. So we say, okay, provide bright lighting. For some of us, maybe if I go near there, I can't read. I say, please open the door, let the light come in before I can read. So you do that for them. And also, glare, that is light going into their eyes. So we should avoid it and encourage daytime appointment. That is things they can do at 5 o'clock. Don't let them say they're going there at 8 o'clock. That's when they are going to see their friend at 8 o'clock at night. They can't. It's difficult. It's more and more difficult to encourage them. And also reading. Certain things I can read them easily. But when the prints are too small and too fine, it's difficult for me, even with my glasses on, to read. So these are the various little things you should do and help out as a caregiver. Then taste. We find that most of them don't taste. They don't taste food as well as before because their taste buds, the secretion is also decreasing. And I don't know whether you had experience of people with swallowing. Any problem? Swallowing. Some of them can't swallow this. That's why old people I used to wonder. They either drink Okupe in the morning, then they will eat a cup in the afternoon, and I said, what kind of food is this? As well as one, so they can't swallow all those things because all their reflexes are getting slower. So, be aware of all these changes while you are looking after them. You understand? Then another one very important one is hearing. Hearing for the elderly is very, very, very disturbing for them. You understand? So when I say the most significant change for senior is loss of hearing, not even vision. If they don't see well, it doesn't pain them as much as you can hear. Because you say, Mama, can't you hear what you're saying? Or they just see you just see your mouth going like this, and they can't take part in the conversation. It's very, very painful to them. You understand? Many seniors who appear confused, antisocial, or demented will simply be having a hearing disorder. You understand? This is linked to depression. Of course, they feel depressed. If I stay with you and everywhere is silent, and you are talking, I can't take part in it. It's very, very depressing. So they are depressed, they are antisocial, they are not, they don't want to listen. Many people go and lie down and sleep since I can't hear what they are saying, but they are not happy at all doing that. They say hearing is ranked first in overall stress of aging. It is very, very stressful for them. So please check out these things when you are looking after them. You say, I can't hear. Or you say something, Mama, did you hear me? maybe they're having difficulty in hearing, and then we say, okay, what are the things, little things you can use to help them at this period? Then we say the first thing is you don't hear. Mama, can't you hear? And Bob was this last time, but it's not very good because she cannot hear you properly. So we say these are the management. Don't yell. Lower your tone. You find that even though you feel they can't hear, when you lower your tone and there's no aggressiveness on your side, the person can watch your mouth more and then hear what you are saying. Face to face. Don't be talking at the side or at the back and then expect him to hear. Come in front, face the person and talk. Then, of course, pronounce your word carefully. If you say, maybe you have to repeat that sentence in another way so that the person can hear it. Then we say, okay, as much as possible, eliminate extra noise. Like they are phoning me now. I say, sorry, I'm on the road. Or it's very noisy here. Let me go outside and receive the call. The same thing when you are dealing with them. As much as possible, eliminate extra noise around where you are. Then, of course, we have talked about urinary incontinence. We know that increases with age. So it's not that mama wants to wee on the bed or wee on her pants. She can't control it. Be aware and you know how to take care of them appropriately at that age. And then we talk about sleep. So many seniors have trouble falling and staying asleep. By 75 years, most wake up several times at night. Seniors have less day sleep. So those of you on night duty, like Mrs. Olof Jama has said, you know, I know it's difficult. She didn't even let me sleep because I've had that many complaints. That mama is at 2 a.m. She starts having problems. She didn't even let me sleep. She cannot sleep. She doesn't know that she wants to punish you. She herself cannot sleep. Anyway, your duty, you're not supposed to sleep. If we're on call and we can sleep on some nights because we are lucky, no problem that night. But some nights from 8 p.m. till 8 a.m. the following day, you don't even close your eyes. You understand? Maybe you'll be peeling potatoes like like sister said. But apart from that, other people, therefore, any little noise, they wake up. Even I wake up, you understand? I have less. Sometimes I battle with myself. Sometimes let's say around 4 a.m. or 5 I'll be up looking at the clock. Okay, it's now 4 o'clock, it's now 4:30. And unfortunately, then at 5:30 maybe I wake up, go and take my bath and everything. Then around 7 I eat my breakfast. Then around 8, if I do not go in, I start to be very, very sleepy. Now is the time that I want to sleep. You understand? Good afternoon, sir. You are welcome, sir. So that is part of it. Then the muscle are bone, like use it or lose it. If you don't exercise yourself, exercise your muscle, your bone, to become weaker and weaker. Understand? It says regular exercise prevents delayed disease, disability of the muscle. So again, like we talked about, you should try and encourage exercise as much as possible. When I say exercise, unless the person is totally paralyzed, cannot move, even if it's lying down, even if it is moving the arm, even if it's, encourage any form of movement. And if the person can sit up, let him sit up. And if the person can move from chair to wheelchair to outside as much as possible. And if the person can walk up, encourage help so that they are constantly using their muscles, to exercise as much as possible. Then, when you do this, then preventing